Hi friends, I am Dr. P.K. Hazra from Kolkata, AMRA Hospital, consultant cardiologist, and I am practicing here for last 25 years. And I am treating a lot of people with comorbidities. These include hypertension, diabetes, the heart failure, and morbid obesity. Now, in 2021, as a consultant cardiologist, I do face a lot of people suffering the bad effect of hypertension on different organs. And it is quite true that all over the world, the incidence of hypertension is increasing day by day, not only because of genetic predisposition, but maybe due to lifestyle modifications, the air pollution, the sound pollution, the stress, and it's a leading cause of death in the world. And it can cause hemorrhagic stroke in the brain, non-hemorrhagic stroke in the brain, left ventricular hypertrophy. So heart gets enlarged, heart ultimately fails. On the top of that, if you have diabetes and high cholesterol and bad lifestyle, you lose your kidney very early in your life. So, what we need to do from the very beginning of our life, once we grow with age, we should modify our lifestyle by reducing salt intake and also stay away from stress along with some antihypertensive drugs. Now, over last many decades, many drugs came and many drugs disappeared because of the side effects. Nowadays, we have 3, 4 drugs plus a pacemaker, a angioplasty device like RDN, like a ablation and laser therapy on the kidneys, and in the future, maybe genetic alterations or genetic editing will come as a treatment of hypertension, diabetes, cholesterol, etc. But before that, as I said, to be simplistic, we need to continue this drug lifelong. Now we have one class of drug that is called diuretic, second class of drug called ARBs and ACE inhibitors, and third class of drug is called calcium channel blocker. These are easily available, attractive, affordable solutions to many Indian patients, even in the hinterland of India. Now the problem is the compliance. Now the compliance can be increased by combining 1+1 tablet, that 1+1 chemical composition of drug can make it a wonderful, and it is very effective, and it is prescribed as a single pill with half dose of each molecule. So you get the benefit of both molecules, less side effect, and from the very beginning we get good control of your hypertension. And once the hypertension comes down, one should continue these drugs lifelong. Now, there are many different organizations, society to define, to declare the goal, the target. I don't want to confuse with scientific data, but if you're symptomatic in the form of headache, irritation, chest pain, if your creatinine is going down, if you have heart disease, if you have angioplasty, stroke in the past, if you are having a family history of bad cardiovascular illness in the form of stroke, heart failure, heart attack, and kidney disease, one must be very careful to discontinue these drugs. It can be discontinued or reduced in dosage if you are having symptoms due to the side effects of the drug, like if you are having a postural sense of falling and a giddiness due to drug, or a cough, or severe leg swelling, or your sodium potassium is going down, then it makes a point to discontinue or reduce the doses of the drug. If somebody do not have all these side effects, one should continue these drugs lifelong, and you should consult your physician to regulate this drug. And ultimately, your consultant knows how much, how long, in what combination this drug to be given to the patient. And patients are misguided. These patients are misguided because of a lot of myths that once you are hypertensive, if you take drugs, it is going to damage your kidney. So this myth has to be broken by continuous counseling, conversations, and good narratives to be passed from physician to the patient so that patients get benefited out of this conversation. Now, if you have diabetes, your target should be 120 by 80. If it goes farther down, doesn't matter if you do not have any symptom due to low blood pressure. If you have heart failure, along with hypertension, diabetes, you may have to continue many drugs like low cholesterol drug, a newer anti-diabetic drug, which can give extra bit of life. Those are called phogins. Those are called GLP-1. Some of them are injectable. And in those cases, you may be taking 5, 6 drugs. Few of them are meant for heart failure. Few of them are antihypertensive, but basically works both for heart failure and for hypertension and also for diabetes. So these are miraculous drugs in 2021, and the penetration of this drug merely 1 to 2% in India. It like many other popular anti-diabetic drugs, where metformin, the sulfonylureas, etc. These chemicals are prescribed more frequently because these are easily available, cheaper drugs. So these drugs price, the cost should be also a consideration. And nowadays, because of manufacturing process got easier in India, and we are exporting many of these molecules. So these Indian products are of good quality, up to the mark, and matching international standards. So be with Indian drugs, be with Indian products, you can feel confident that these drugs are going to be very effective if you prescribe very early in your life. That means some of these physicians who are listening, they have to understand that it is you who can change the lifestyle of the patient by counseling, but you cannot change the renal death or renal risk or cardiac risk until unless if if you prescribe a drug which gives mortality or death benefit. So these hypertensive drugs reduces death, reduces renal death, the need for renal transplant. If somebody gets these drugs very early in their life, if somebody is hypertensive, they have to live with hypertension or diabetes or hyperlipidemia for pretty long duration. So the time taken by these risk factors to damage your kidney will get prolonged if somebody is having these drugs, as I mentioned, diuretic, ARBs, calcium channel blockers, because these are organ protective. Now, sometimes these drugs fail. Fail means you do not discontinue. That means you are resistant. Then you have to take help of renal denervation, a new therapy which is done like an angioplasty on both the kidney arteries. We apply a radiofrequency ablation, energy, high energy. This doesn't have any side effect. Though it is expensive, it works maybe in certain group of people where the number of tablets or the resistant hypertension become more responsive to the drugs prescribed. Now, these renal denervations with radiofrequency energy can also be done by alcohol injections of the renal arteries, by ultrasonic wave therapy, this ultrasonic therapy of the renal arteries. So these are our new dimensions, or these are new intuitive, innovative therapy for renal denervations. These are again costly. It is done only by few centers like us. So these are basically for those people who cannot tolerate these drugs. So, ladies and gentlemen, to summarize then, hypertension is a real threat to the humanity. Many of our friends and our family members and patients suffer from hypertension. Early detections by recording your blood pressure in the clinic, then early treatment and a combination of therapy with good drugs, especially if you have these drugs at low dose to start with and gradually build up, and you can avoid side effects. It can give good quality of life, can prolong your life, and can prolong or it can delay the death of many people. So disability can be limited by antihypertensive drug. If you have diabetes and cholesterol, do not forget this modern diabetic drug, which is not insulin, not metformin. If it is flozins or GLP-1, injectable and tablets, along with your lifestyle modification and cholesterol reductions. Cholesterol reductions means reducing cholesterol with vaccines, with your statin, your drugs, and bringing down the LDL cholesterol as low as possible, almost towards zero, by lifestyle modification, diet, exercise, no smoking, no alcohol, stress-free life can give a good quality of life and also can prolong your life, can delay deaths, and can prevent many, many deaths, premature deaths in the society. With that note, I'd like to thank you for your kind attention. Thank you.